Hi guys, good evening. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, creator and founder of Balance and Fall support group in aging adults. It's me again, Dr. Jenny, and every Thursday we highlight innovator, physical therapists or different clinicians who are making waves in their platform and also their clinic setting and also academicians. All these wonderful clinicians where we can learn more about them. All right. So this Thursday, we have the opportunity to learn more about mobile concierge therapy or wellness. And she has a great leadership. She is a physical therapist and doctor of physical therapy and certified exercise expert in aging adults. She's the president and founder of Live Your Life, based in Minnesota and Florida. Maybe more state to come, right? So without further ado, we have Dr. Eva Norman. Welcome, Dr. Eva. How are you?
Oh my gosh, it's so great to be with you, Dr. Jenny. Thank you so much for hosting me today.
Oh, you are welcome. Thank you so much for this opportunity. We always see your wonderful webinars and social media that give us nice tidbits or knowledge for us, especially for our aging and older adults. So thank you for what you're doing. Where's the passion getting? Where do you get that passion of serving our elder and older adults?
That's such a great question. Well, besides the fact that my grandma's raised me when I was younger, I have to say am very fond of the aging population for that reason, first of all. But kind of my why behind my business and why I work with the aging population is so years ago when I was 13 years old, I was involved in a hit and run accident where I was told I would never walk again. And thanks to a physical therapist, I am here before you with little to no deficits. And she's the one that really inspired me to work with the aging population. I shadowed her. I wanted to be her. She gave me a second chance of life. I often say physical therapy saved my life, but Jean saved my life, really. And she loved the aging population. She worked in rural Pennsylvania, and people would drive 30 or sometimes even 50 miles to come see her. And I remember when I would volunteer there, it would just be, I just felt like it was like my grandma's all over again, because they just treated us like family and were just so kind and always so appreciative. And I think learning and being mentored by someone that really highly respected the aging population and did so much for her community really inspired me to do that ongoing.
Wow, I didn't know that. That's really
Mhm.
like that's another unique thing about you, right? We always have this story of this why we are doing this. And then I have another interview that he is helping the aging and older adults because of his grandma who fell and had a hip fracture, and that's why he's doing more on fall prevention. So
Uh-huh.
just like close on what you just said. So tell us
Mhm.
more about Dr. Eva. So how many years you practice as a physical therapist and how you transition to be an entrepreneur as a founder and president of what you are right now?
That's great questions. So I've been a physical therapist, well, for a little over 25 years, which is so crazy to say that. And what inspired me to start Live Your Life? Okay, so it starts with my story as to like why I love the aging population too, right? It actually inspired me to be a physical therapist, and it also inspired me to start Live Your Life. Um, so let me backtrack, because this is a really good point as to why I have the practice the way I do. So when I was, remember I mentioned earlier, when I was 13, I was involved in this accident.
Mhm.
About 4 months into my rehab, we received a letter from our insurance company that I had reached my annual cap. And so my parents were forced to pay privately for me to get ongoing therapy. And so we looked everywhere. We couldn't find, at the time, there wasn't like cash pay therapists like there are today, right? And
Mhm.
even the hospital didn't offer that. And I don't know if they were afraid of not getting paid, but back then that wasn't an option. If you didn't have insurance, pretty much you went without. So they had payment plans and things, but it was just so much red tape, unfortunately. And so my parents actually put an ad in the paper. I feel like that ages me, but they put an ad in the paper to find somebody, and they found Jean McConnell-Cupolo. I mean, she's just amazing. Jean, if you're listening, I love you. And so Jean, extraordinary. She worked with me for probably a good 8 months. And at the end of those 8 months, my dad, well, my mom and dad, kind of both. My mom promised God that if I live, because I truly feel like she gave me a second chance of life. Because during that period of time, in that 4 months, I actually tried to commit suicide. I was very depressed. I was on narcotics, and God only knows. And I was so socially deprived. I was very isolated because I had a lot of wounds. And so I had to have people, anyone around me had to be around precautions. So I got extremely depressed. And but after those 12 months, my mom promised God that if I live, we would give back to the profession that we feel saved my life. So that's actually a big part of my service to the association. It's my way of giving back. And then my dad made me promise that someday I would have a business to help others in my similar situation. And so hence the name of the company, Live Your Life, because we're helping others live their life like Jean did for me. Because I truly believe I had a second chance at life. So thanks to her.
Yeah, I love it. Yes, Dr.
Mhm.
Eva. It's really a touching story, and you're giving back now. And then you really know the impact and the benefits of physical therapy, and you yourself was the patient that was affected on this red tape, and now you really feel what they will feel, So now you are now the instrument to prevent those to happen or help more people who might be in your position before. So thank you so much for that. So how does it begin? So how did you get all the same wonderful clinicians? So how does it work, Dr. Eva?
Yeah, that's so great. So we started our company in Minnesota 11 years ago. Okay. And people are like, okay, you've been a therapist for, over 25 years. Why did it take you so long? Remember, we're entrepreneurs, we're risk takers. I was truly afraid of failure. I didn't want to disappoint my dad because it was a promise I had made to him. Remember, that was a promise. And so I didn't really, honestly, the management aspect of it is not what drives me, what inspires me, what motivates. It's helping people, right? It's helping them, touching their lives, transforming their lives, right? And to be healthier, to be better, to move better. That's what inspires me, right? That's what motivates me. So, so it took a while. It took a while for me, and unfortunately, it took a job that I honestly was very toxic environment. Folks for listening, the productivity, right? Like just unbearable. Just really unrealistic expectations. And I was really burnt out. I was truly, I understand when my students tell me because I've experienced that. And it wasn't even fun anymore. I just wasn't being inspired by just from what I was doing because I just felt like I was more of a dollar sign. I felt like I was more of a widget than an actual human being. And, and they were just, obviously demanding so much. And so it took that to me and my husband, honestly, my husband's support to take the plunge and start Live Your Life. So I left this toxic job. I literally walked out. Not that I recommend that to anybody, but sometimes it's necessary to seriously for your own health and well-being.
Exactly.
But it unfortunately it took that because I didn't want to abandon my patients, to be honest. It was really came down to my patients, but my husband really inspired me to look at other options. And so I'll never forget that day that, I left and literally I knew I was starting a new beginning. And so when we first started, I knew I wanted to do something that hadn't been done before. Because what I was finding time and time again, there were patients that going through that vicious cycle, right? In and out, like seriously coming back on caseload every 3 months. We all see it every setting, whether it's acute care, skilled nursing, TCU, outpatient and home care, right? And I wanted to prevent that vicious cycle. I wanted to prevent that downward decline that we see, that functional decline that unfortunately you see, because so many times we discharge our patients with a great home exercise program. I spend time with that program. And I even show them the progression that they can utilize over the next, hopefully 6 months to 12 months. I would spend hours on those things, but come to find out that when I left them, And they came back on caseload. I'm like, what happened? And, you know, people would say, after you left, I just, you know, kind of forgot. Or, hey, you know, or I found my program under a pile of newspapers or magazines, right? Or unfortunately, it was more than just that. It was just also, there wasn't someone to help progress things, continue the education, continue to monitor their medical condition too. So they were missing a lot of pieces. And it's more than just physical. They weren't, you know, also looking at their nutrition status, their medications, and just following up with their medical appointments. I mean, there's just so many pieces to it, right? So I wanted to fill that void because, and unfortunately, once they discharge, if they don't qualify for maintenance, you know, or there isn't something else, perhaps like outpatients from, say, a home care setting, they're home. They're not doing anything. So I wanted to fill that void. So I thought, okay, that's the model. I'm going to create a model to fill that void. So what I found in talking to my legal counsel, because I had to figure out, okay, what do we call this? So people are thinking that this is covered by insurance, right? Because it's unfortunate that this is not covered by insurance.
Yes.
So we called it wellness. And at the time, this is 11 years ago, we were in infancy, in our profession was in infancy stages of that term. Like we were had just defined it in the House of Delegates. I've been a delegate for a long time. So these were very new terms to us. So I knew I was going to be a pioneer in this area. And there wasn't a manual. There wasn't like a committee I could talk to. Like right now, you know, there's a prevention health promotion council, right? That actually we can talk to. There's, you know, there's SIGs now and all of our various academies. But back then there wasn't any of that. And so let alone, you know, even in my state, there wasn't anyone else that was doing anything like that. So I thought, okay, well, let's work with legal counsel and figure out the best way to do this. So I started out just myself doing physical therapy. I partnered with a lot of outpatient clinics, hospital settings, because sometimes, as we know, people get discharged with nothing. And what do? So, but I thought even if they qualified for skilled care, I could do a wellness exam and then refer them, right? Refer them to skilled care if they qualify, right? And so, and I wanted to target, well, I actually, to be honest, I worked the full spectrum of care. It wasn't just the aging population, although that was my favorite, always has been, but I opened the doors to everybody. I wasn't going to like turn anyone away. So, so that's literally how it started. But then what we were also finding, by the way, when I first started, there was, I should back up a little bit. The other reason that I didn't start is because we didn't have full unrestricted direct access for wellness in Minnesota, which is where I was practicing when I first started my practice. And at the time, when I had the idea of the practice, we had to get a physician referral to do this care, which was craziness, right? To have to get a referral for services not even covered by insurance, but our state practice act required it. So, and we also had to get one every 90 days. Well, we all know wellness doesn't discharge, it's forever. So it just seems so crazy that, okay, to do initial assessment, I needed to consult a physician and then every 90 days, and only because I was doing something new with this individual. And so I wanted to connect with the physician to help them understand, you know, why I was seeing this person. So then at 90 days, they weren't like, what is this? Why is she asking me for an order? I didn't even know she was seeing my patient. I wanted to be that well aware. So that's why I requested an order from the initial assessment, because it wasn't really required. We had 90 days, but I wanted mostly for a communication. And then at 90 days, I was needing to get an order, right? And I did a little bit on the side, to be honest, at the time. I did it under my own Social Security, but then decided in 2013 to actually start an LLC and start my company, because we ended up getting legislation passed to have full unrestricted direct access for prevention. I was on the State Government Affairs Committee team that actually helped make that happen. So, which was so great. So all of you out there, that's something that's so important to make sure that you have in your practice acts, you know, the ability to do this. Because I think a lot of times people think, well, it's wellness. Why do I need orders? Well, your state practice act might actually require you to, maybe even every 30 days, or maybe even from the get-go. So something that's important for you to take a look at. It could be certainly a barrier, right? Because sometimes getting that access to that care, to doing that type of care, unfortunately, can delay things. So, but it's important to read your practice acts to make sure. So once we got started, thankfully we had full unrestricted access for wellness. We started with physical therapy, and we worked primarily with individuals that exhausted their benefit, but then we also worked with individuals that really primary prevention, individuals that just wanted to just stay on top of their disease, their disorder, their dysfunction, whatever was going on, so say they had Parkinson's disease.
Yes.
So a lot of times folks will join, a gym or something. And of course, Big and Loud has been around for a long time. So they would perhaps join, even a Big and Loud program. So we would get connected. We would connect ourselves to some of these places. I just bring up Parkinson's as one of them because we know that's a progressive disorder. And especially if you're not exercising, research has shown, my gosh, unfortunately, you're really missing out, right, to maintain your mobility. So we partnered with a lot of these different clinics, specialty clinics, and therapists that were working with these individuals to see if they would consider us just doing monthly check-ins, to do an annual exam, and then perhaps either monthly or quarterly check-ins where we could monitor that. We did telehealth. So what we would do is we would do our annual exam. We would do follow-up telehealth visits, and then do monthly reassessments just to make sure they're on track. So at that initial assessment, by the way, all of our assessments are 90 minutes. We create the program for them. We not only evaluate them, but we also create the program and we educate them on the program. And then we do follow-up telehealth visits to make sure they're doing the program appropriately. And then along the way, along with that initial assessment, we're looking at, we're doing a disease risk profile. We're looking at their current physical activity and how we can add to that. We're looking at their nutrition. We're looking at their sleep. We're looking at stressors. And by the way, we're using evidence-based tests and measures to assess these things. We're looking at depression. We're looking at alcohol consumption, and then of course, smoking, if they are or not. So we're looking at all these different areas when we're first doing our initial assessment to determine to see whether we need to refer them to other providers to help them in these areas. Again, using the research to identify issues and then getting the right providers to make sure hopefully we can help this person truly transform their life. So we're trying to look at them holistically, not just physically. And so, but beyond that, we do look at other aspects of their wellness, their social, their intellectual, their spiritual, their emotional, and their occupational well-being and financial too. So, we look at all of these things to see who we could perhaps refer them to as well to help them, again, with that holistic model, making sure that nothing's falling through the cracks. And because we're truly going to transform a life, I always say it takes a village to transform a life. As much as the physical therapy profession would love to say we can do it on our own, I have found through my experience, it's really helpful when we have a team. So, and I quickly found that out. So literally year one, I wanted occupational speech therapy right away because I was finding I needed my team, just like I had in rehab. I needed my team in the wellness world as well. But I have to tell you, it wasn't always easy to find. But initially off the bat, I was able to get a personal trainer because a lot of times these folks, once I developed the program, they just needed a coach, right? Which isn't really physical therapy, to coach, to do their program, right? To coach them and motivate them to stay on track, right? And so then I would come in and do monthly reassessments. And I also hired a dietitian right off the bat too, because I found so many of the issues. If I didn't mention earlier, part of our disease risk profile is also nutrition. So, and that was one of the things that we commonly saw was a problem with almost every patient, regardless of age. So having a dietitian on staff was invaluable. There wasn't one patient or client in this case, because these are private pay, that wouldn't benefit from having a nutritionist. Just assess and then help them figure out what they could do to hopefully improve that. Sleep is also another thing that I would say was very common to see an issue in all age groups. So we initially started with the PT, personal training, and dietitian. Year two is when we brought in the occupational and speech language pathology, which honestly really sealed. I felt like, my gosh, we had the team. We had the right team in place to really help us truly transform lives. And we added in year two also acupuncture and massage because we were seeing a lot of chronic pain individuals who were coming to see us. And I will choose acupuncture massage any day over pharmacology, right? So any drug, so forth. So we found that to be extremely valuable, especially for those folks, but also those folks that were suffering from depression and having a tremendous amount of stress. Again, we were seeing this in all age groups. And it's so interesting because for whatever reason, up until that point in my career, I had seen it primarily with the aging population, just because of the isolation, the boredom, the hopelessness that many of them were feeling when I worked with them in skilled nursing and in home care. But what I was finding is this was something real in all age groups that honestly, I think I had missed out. So suddenly I was finding myself screening every age group and found that that was so necessary. And our massage and diet in our acupuncture team has really helped so many of those folks that have really suffered through that. But then it really opened my eyes to also the fact that even acupuncture can help more than just that. Again, I'm not an acupuncturist, so having acupuncturists on our teams also opened my eyes to other areas that they focused on. So essentially, if you think about it now, we're developing this true wellness clinic on wheels, right? And so, so we started, really our service area started expanding because suddenly, I mean, with this whole team, there really isn't anyone that we could honestly say we couldn't help. Now, we would sometimes have to convince them of that because we're paying privately, but we found there really wasn't anyone. And we really didn't, until this day, we haven't really closed the doors to anyone. So, and we have seen just about, it feels like just about every condition, disorder, dysfunction, disease. And I'm really happy to say we've been able to help so many people. And I've been able to hire now with respect to the question that you asked about hiring. So I wanted to make sure that we had, especially for physical therapy, because there's so many specialties to our profession, right? I mean, if you think about all the academies and sections that we have, right? There's cardiology, oncology, geriatrics, neurology, orthopedics, et cetera, et cetera. I wanted to make sure that Live Your Life was well-rounded. So I targeted, first of all, we only hire APTA members with regards to PT. And that goes for the other professions too. They have to be a part of the professional association. And I also love when they're involved. That's like an added plus for me. But at the same time, I also wanted to make sure that we had different specialties on our team. So I targeted certain individuals based on their specialty. And it wasn't just geriatrics and neuro. It was important to do other specialties as well, because we all know we see a little bit of everything. But what was so nice about doing that is it really, and that's why I said there really isn't any condition, disease, disorder, dysfunction that we turn away, because we have all those specialties represented on our team, which is really nice. And then of course, for the other professions, I don't necessarily have that, but I have selected, I'm very selective on who we hire, but we try to find people with a very diverse background that have worked like the different spectrums of care and the different populations, the full spectrum at some point, perhaps, maybe not currently, but maybe over their career they have to have at least 10 years of experience. Again, remember, we're cash pay. So you can imagine when someone's going to pay privately, they want to know that they have the best in their home or the best in their community providing services, because it is a lot of money, right? And they're investing. And, and I think also I want people to understand, I think a lot of people have the misconception that we just cater to the wealthy. That's not the case. I would say the majority of our clients are middle class. They're just invested in their healthcare. And so, I mean, just think about how much you pay for your cell phone bill a month, your cable bill a month, right? Yeah. Oh my God, we're a lot cheaper than that a month.
Even the auto insurance, that's so expensive.
And so remember, these are monthly check-ins and so forth. So, and we're far more cost effective, and we're obviously hopefully helping people, live healthier lives too for less money, which is really good. And that's the other thing that we have really, I feel we've done a really good job trying to make it very cost effective. We also take there's a lot of life insurance plans that cover the cost of our services. Also, the VA has benefits for many veterans that will cover our services. And then there's also been, and I share this because I think it's important for therapists across the country to know this, but there are also associations, foundations out there. So MS, Parkinson's, American Heart, Stroke, that have money dedicated to these type of services. And so it's just a matter of doing your research and having your clients apply for these type of stipends or scholarships or whatever grants that they may have available. And those dollars have been able to pay for our services as well. So, I mean, it's amazing. And there's also even county services, state service, that we've been able to also work with, both in Minnesota as well in Florida now, that have been able to cover our services too. So we'll be very clear that it's really anyone, if they really want to improve their health and well-being, coming to us, we can find a way to cover your services. So I encourage many of you, if you're wanting to start this in your practice, to do it, because don't let money be the reason, like thinking that your clients won't be able to afford. Don't let that be the reason why you're not starting services like this, because it is possible. So yeah.
That's really amazing. That's only 2 questions and you answered everything. Yeah.
Fabulous.
From who will be the people who will benefit with it, and how did you hire, how your wellness begins, and then your passion. It's all on those answers. That's really, really amazing, Dr. Eva, because you really transition from these are the qualifications of very good clinician, because you have a rationale of why we hire this, and you want to give back, and you want them to be part of the organization, so they will be good quality service for the people, because they're investing in their money, so they're paying, and that's really important for them. So that's really good. So what skills do you think, or how can they begin, do you think, the people like our listeners right now, they are clinicians, and where can they begin? Is it more improving by learning from different courses, or learning more about marketing and sales or something? How does it work? What do you think?
Well, first of all, with regards to marketing sales, I feel like, and it's unfortunate in the PT school, there's not a whole lot, right, that's shared with us. But we all are marketing every time we touch a patient, the fact that we're getting them to come back, right? Whether it's insurance or not, right? So I don't want anyone to think that's listening to this that you have to be great at marketing and so forth. But I think the other thing is you have to have passion for your work, because people feel it. People feel when you have passion for your work that you really care, and we have these qualities as therapists, but don't be afraid to share like how important they are to you. You'd be amazed. Like we have a very meaningful relationships with our clients. And I think it's because it's such an honest relationship. So I would say, be willing to share and open with them, especially in this wellness world, it's a long-term relationship. It's nothing short-lived. Like the rehab world, right? So this is something that you hope your client will be with you. I have clients that have been with me since the beginning, and so I may only be doing annual exams, but they've been with me since the beginning, right? And it's so great that they check in with me, just like they check in with their physician. They see me as well, and just to make sure they're on track. And so I think that's something important. And you know what, Dr. Jenny, I'm forgetting the question now, because I feel like I'm going in. Oh, you mentioned about marketing. Oh, the skills, right?
The skills. Yeah, that's the marketing part. And then how about the skills? Yeah.
I wanted to get into that because I think a lot of us think that, but it's not to say that you can't benefit from, say, networking. Like joining a networking group also can be very valuable, because these are services that not everybody knows that even exist. Like, it's so amazing when people hear like wellness, physical therapy and wellness. Like, tell me more about that. What is that? Is that rehab? I'm like, no. So I think that's why I think networking is kind of, joining a group where you can educate your workforce, so to speak, in the group as far as what you do is helpful, because they can also, share with their friends and so forth. That can certainly be valuable. And and joining the private practice, if you're going to start a private practice, like joining the section is definitely a must. And I would say going to the conference annually has been invaluable to me. So I would strongly say if you want to grow your practice in this area, if you want to develop those networking skills and maybe improve your marketing and sales skills, that's another great place, but not necessary. Because I'm sure you're listening to this and thinking, I don't have the money to do that. And that's okay. But also know that there are people like myself and even Dr. Jenny. I don't want to put you on the spot, but there's many of us out there that are more than willing to help mentor you. So don't hesitate to reach out too. So, and I'm sure there are many people in our academy that be more than happy to do that. Because remember, we at one point also needed help. And thanks to the generosity and kindness of others, we are here before you. So and all my mentors have said, just pay it forward. So that's why I have no problem if you guys want to reach out. So don't hesitate. Be happy to help you get started. Now, some of the courses that I think could benefit, you could benefit from, especially foundational, I would say, well, getting your GCS is
Yeah.
fabulous. But if you're like, oh my gosh, that's such a huge investment, don't necessarily have the time to study, the certified exercise expert for the aging adult, that's something actually I have all my staff go through. So at some point when they're with us, that's definitely important. I have found it to be extremely valuable if they don't already have their GCS. Because of course, if you have your GCS, it's very similar. I feel like very supportive, although I have colleagues that have their GCS and their CEA, so
Yes.
and have both and have found them both to be valuable. But I mean, of course, it's all a cost, right? So, but I would say if you're trying to save on cost, and now I understand it's going to be hybrid, which is really
Yes, I'm
exciting.
about to say that.
I know. I think that's going to be fantastic because more cost effective. And I think more people being able to do that. So, of course, now my staff's like, yes, I want to do it, which is so great because we've been waiting for them to come to us back to Minnesota again because it's been a while. So I would say that's a great place to start. I would see another, and I'm going to put a plug in because I fund my staff to go to CSM, and I just think CSM is also invaluable for many different reasons. But I find that, remember, I was sharing at Live Your Life, we have different specialties. What a great place to go to one conference where literally your specialty has a whole track. Like there's no other place where you can go to. But the nice thing is for us, because each one of my clinicians is so diverse, like cardiology might be one of their specialties, but they also, work with individuals, like work with pediatrics, work with geriatrics, you know what I mean? And so work with athletes. So, and here at this conference, you can get a little bit of all of that,
Yes.
right? And find courses that perhaps address your weak areas, right? Your areas for improvement. I think that's why I've loved. And of course, another great place to network, another great place to meet individuals like me and Dr. Jenny, which we literally just met at CSM in
That's where we
Boston.
met. Yeah, we always see each other in LinkedIn, and then
Yeah.
not really on Facebook, but we're more on LinkedIn. And then I know we have common friends too, so I know you by name. And I just
Definitely.
haven't met you. So when we pass by in CSM, I know because by
I
your
know.
face and picture. And
So
also another thing, Dr. Eva, I just want to say also the exhibits in the CSM. That's amazing, right? That what we
yeah,
can use, what the different innovations now, especially you're doing wellness. I love those different exhibits that we can use at home, our service, even clinics or not. So that's really good.
and
Mm-hmm.
it's also, I was trying to convince one of my staff members to join neuro. And so I had her going to had her go to the business meeting at the board of directors. And she's like, oh my gosh, I want to run for the committee. I'm like, what? Oh my gosh, just for going to these meetings, because you just never, I'm just always amazed like how people get so inspired when they go to these meetings. So that's the other thing too. You can also get really well connected in perhaps your area of expertise, or maybe another area that you are hoping to grow in, just by going to these meetings and then meeting other experts in the area that can potentially mentor. And that's one thing I would encourage every one of you, if you don't have already, to get a mentor. Obviously, I'm happy to be your mentor, but I mean, it's always important to have more than one. I mean, I can't even tell you. It's like endless for me how many I have. I just have them in different areas. But if you're wanting to start a practice, it's good to have someone in private practice. And of course, if you're wanting to work with the aging population, perhaps someone that's a part of the academy, and maybe you want to do some neuro in there, some ortho. So having different mentors in different areas is helpful, because there's always clinical questions that come up that you're like, gosh, I wish I had an expert or someone that I could talk to, right? And that person isn't always maybe a part of your team, but having those mentors that are readily available to you that can help you problem solve has been invaluable to me. So I encourage you to have those mentors. And what a great place. Again, CSM has been invaluable because I have pretty much found all my mentors, and I've been going since I was a student and practically not missing hardly any years. So
Yeah,
yeah.
I like when you emphasize to be well diverse, like
Mhm.
specialize in different, because that's really true. We're not only serving the aging and older population. I love when you emphasize that you're seeing also pediatrics. So I want that everybody is not only like me. I'm geriatrics, and now I am now inclined in acute and inpatient rehab. So I am more involved now in neuro. I'm learning more on brain injury and then stroke rehab. So I have already part Parkinson's knowledge already, but it's just great to know more and more. And then I met a manual physical therapist, and I always learn from my interview. That's why it's my pleasure to learn more. There's a manual therapist we have that he said, as long you have a bone, you are at, you will be treated because you are like orthopedic. You cannot remove that because you have a bone. You will treat hip replacement, pain management. They are all related to each other. The neuro, the geri, the ortho. So this is us. So we really treat, you all emphasize that. You treat holistically, and you say that
Oh,
already. So congratulations, first of all, Dr. Eva. This is
thank
amazing platform that you're serving the wellness population. I think the big key is education, right? Because I'm about to ask you your challenges, and you touch it a little bit. Because
you.
I said, here in my area, the question is, oh, I am a geriatric physical therapist. So my patients are all Medicare. So what is the key word? Like just a short term or easy layman's term that our clients will understand that this is wellness, this is Medicare. How can you help us to explain this to our new clinicians?
That's a great question. So,
Mm.
and earlier in the interview, I shared with the fact that we do a 90-minute wellness exam. So our annual exam is 90 minutes, and really even our quarterly, monthly reassessments are 60 minutes. But again, when we first start, it's 90, and for good reason, because we want to do a very comprehensive. Remember, we have a very holistic approach.
Yes. Yes.
And during that exam, because it's head to toe, looking at everything,
Mm.
there is a good opportunity to see whether the individual has skilled needs, right? So if you identify those needs, you are required by especially if they, so these are, we're talking about now Medicare beneficiaries, right?
Yes. Yes.
So if they're Medicare beneficiaries, we are required by federal regulations to refer them to skilled care if they have what Medicare terms as skilled needs. So that potential to receive rehabilitation services, they have the potential to progress, right?
Okay.
The
Okay.
skills of a therapist to do that, right? So if they have that skilled need, then you should be referring them to a provider. And you can determine that in your exam, right? Whether that's possible or not. Now there are some folks that come to us that have just been through the whole gamut, acute care, then they went to subacute, then they went to
Home health.
outpatient, and now they're coming to us. So they've exhausted their benefit, right? So those are a
Yes.
little easier to determine someone that needs wellness because they've been through who knows how many months, right? And so it's easier to determine. But then there's also individuals where they come to you and there hasn't been any injury, there hasn't been a change in their condition, anything that would really warrant perhaps like the red flags flying, like saying, oh gosh, there's something going on with this individual. They could even be healthy, and maybe not on any medications, but because they're predisposed, maybe they have a parent that had osteoporosis, maybe they had Parkinson's, MS. I mean, you never know the reasons, but they'll cut that. Those folks, truly, you can imagine, they're coming to you for preventative care. They're coming to stay healthy. So these are folks that it's so easy to identify, right? That they require wellness services. And they could be Medicare beneficiaries. I mean, my dad, until the age of 80, never had a medication. And he jogs 2 miles a night with me. So, this is my dad, so, I mean, and he lifts weights, and he honestly can lifts more than I do. I mean, it's truly, I mean, I always say age is just a number, right? It's
Yes.
really just a number. And so I think it's important to identify that there are these individuals out there that, that just want to stay healthy and, and are just looking for our expertise for the right exercises to keep them healthy and the education. Because so many of them, I mean, my dad has a lot of underlying issues. And so he obviously sought my expertise because he wanted to make sure that he wasn't going to injure a shoulder injury that he had, rotator cuff injury that I had from years and years ago. And also he ended up, he had a Achilles fracture from playing tennis. And so he wanted to make sure that he was doing the right exercises. And granted, but my dad's like completely healthy. So here's someone that, obviously just is trying to sought out, a professional to get the right exercises to make sure that he's continuing to progress, and continuing to stay healthy and progressing his strength his flexibility, his aerobic capacity, his and maintaining that balance. So like wanting to make sure all his systems, right, including and I love the fact that he even knows the term vestibular, probably because of me. And he knows like if condition 4 on the modified cat step is not 30 seconds, he knows it. Okay, like
Wow.
because he checks himself all the time, and I have him doing like VOR exercises when he goes for a run. So I mean, those are the kind of things that he, like individuals like him seek out professionals. And I give him as an example because he's my dad, right? So, and he's
Yes,
given me
yes.
permission to share this. But we have so many clients like him that seek us out for the same thing. So know that there are people out there. I mean, even like think about those folks in senior games. We treat so many of them that are just trying to get their pickleball, like they're trying to prevent injury and trying to maximize on what they can do with their program to make sure that they continue to stay healthy and win, time and time again, and continue to progress over time their strengths. So yeah, and who better but for us to
That's
seek
really
out
good.
prevention and continued health and wellness. So
You are
yeah.
amazing, Dr. Eva. I learned a lot. There's only 30 minutes chat, and then you explained everything. And then I really feel you deserve a congratulation, all of your team, because this is really a big team. There's really no too much practice, even a home health that they have acupuncturist, of course, because this is a wellness, right? So you have, this is the really different kind of wellness platform where you will have a acupuncturist, massage therapist in one, yeah,
Mhm.
and dietitian. I know that the benefits of that really, because we even have a dietitian that we really use, and for reference resources that's really preventative for the different cases like congestive heart failure and diabetes that we really want to learn more. So thank you so much. And if they have lots of questions, they would love to learn more about this, how can they connect with you, Dr. Eva?
Definitely. Because I was going to say, I honestly, this time went by so fast. Like I was just thinking in my head as you were talking, oh my gosh, the ABN form that we want to talk about, for
Oh,
Medicare
yes.
beneficiary, want to sign. So there's so many, and I just bring that as one example, but I'm thinking of others now. If you want to learn more, obviously, how we've been able to maintain compliance, right? Maintain federal
Yes.
regulations, make sure
Right.
you're doing it right, right? So don't hesitate to reach out. So I would say one of the best ways is email. Eva.Norman at liveyourlifefl.com. But I also am on a bunch of social media. So if you Google search liveyourlifept.com, it takes you to our website. And there you'll see links to all of our social media. So you can connect with us that way as well. Follow us, see what we're up to, and honestly, reach out anytime. My email is also in under the staff profile. You'll find my email there so that you can directly email me also from the website. So hopefully that makes it easier for you all to reach out. And also in our contact page, if you have we've had therapists like even put in like just a scenario just to get second opinion on a patient and so forth. Feel free to put whatever details you want to share. We're happy to get back to you and do a free consultation for you to help you out. So yeah.
Really good. Thank you so much, Dr. Eva. And we really
Absolutely.
appreciate your time. Thank you for sharing this knowledge, your tips, and also your it's very difficult to say. Vulnerability. My God, it's so difficult. Because even you share your experience. I didn't know that you're 13 years old and you had this history, and that's really deep, That's where we get that passion, because the trauma that we have, and it strikes me the most when you said that at that age, my daughter is 14 years old. So at that age, you're thinking already of suicide because of the social impact, that depression, that, and this is a very, even the mental health, this is a very, very crucial age for them, So thank you for putting that also in this interview, because this benefits a lot of people. This interview touched many different things. People who wants to learn more about different wellness, concierge physical therapy, and then that there are different kinds of resources that we have, the different skills, and as a clinician, you can always look and strive better, not always like as an employee, that you can build your own clinic or build your own job or your own company in a small amount of money, but with lots of resources from different mentors, because it's easy to begin when you have a support. So with Doctors Eva, I'm here, different, the APTA resources there, connect special interest group, connect the leadership program, check the different webinars. So there are growth, there room for everything. So we appreciate you, Dr. Eva. Thank you so much. And guys, if you have any questions, you can always connect with us. I will going to put all the social media and email of Dr. Eva in this interview. That way you can connect with her. But first of all, I want to thank you all for always checking on us in Balance and Fall Support Group in Aging Adults. And now connect and check out Live Your Life. Share it with your patients. So if you are based in Minnesota, Dr. Eva has also in Florida. So imagine they have massage therapies for pain management and acupuncturists. I'm sure they love that capping thing. Okay. So thank you, Dr. Eva, and we'll connect with you. Thank you so much, guys. Parkinson's Awareness Month for April. So we need to learn more about that and connect with different physical therapists in your area. All right. Bye for now, guys. Thank you, Dr. Eva. We appreciate you. Congratulations once again.
Thank
Bye,
you.
guys. It's me again, Dr. Jenny Yusuf, physical therapist and Dr. Physical Therapy. So I did a certification as well in Certified Exercise Expert in Aging Adults. So it's really good. So connect with them. They're getting hybrid, so it's easy. All right. Bye for now, guys. Thank you.